All right, well, welcome everyone to the first provider update of the new year, and Happy New Year to everyone, and thanks for joining. The new year has started out with a bang, or maybe has just, continued from last year. And so it does seem we took 1 week off here with this call, and there's just a lot of stuff that's happening. So let me get started on the slides. I'm going to do, and well, let me see, Laura, did you want to?
Oh no, go ahead.
Okay,
You can go
so I'm
ahead
going
and
to do
then I'll
part, and then Dr. Parahone will do the rest. All right. So, okay, and this is the mission hasn't changed. That's one thing that has stayed the same. I just put this timeline. I've been trying to keep track of the various moments in the in the pandemic, and the font just keeps getting smaller and smaller. These are the most recent ones. The AstraZeneca's Evusheld, Pfizer boosters for 16 to 17. Then we got the Paxlovid, which is the oral antiviral approved for emergency use. Then Merck's Molnupiravir. We've got changing CDC guidance for healthcare workers, and then isolation and guidance for asymptomatic people. And then just Monday, the FDA authorized boosters for everyone 12 and older, and a shorter time frame for Pfizer boosters. So we'll talk more about all these things, but just to say the fun continues. This is the not fun news that across the United States, and again, no news to anyone here, but we just have really high levels of transmission, largely Omicron. This is a map from the CDC of the death rate per 100,000 in the last 7 days, and just showing, New Mexico actually is fairly high on the list. This is a new report we've been getting from CDC that lays out, various data elements. But here it actually shows us at number 1 on the number of deaths. There's probably lots of reasons for that. One being we actually have, very clean and up-to-date data. I'd say the other is we have been in a Delta surge where that calmed down in many parts of the country. And at least on what we know right now, it seems like Delta is sort of the more deadly of the two variants, although, still a lot unknown about Omicron. Yeah, and our hospitals have been overwhelmed. So this was a new report for us. We're sharing it with you. Still need to drill down a little bit to understand everything that goes into that. The Omicron variant in New Mexico, our state lab SLD does use it runs PCR tests, and the instrument they use is the one where you can see that S gene dropout. So they haven't, they don't run a ton of tests in New Mexico, but they have been seeing an increased number. So the last number we heard was, about 70% of the tests they're running are showing that S gene dropout. That is kind of like the sort of clue that tells you it's probably Omicron. They also are doing a lot of genomic sequencing, but that takes a long time. So the genomic sequencing definitely lags behind, kind of using the S gene dropout as a clue. So we think, we are basically in the Omicron surge now. On the vaccine front, this is kind of random thought, but I have sort of followed this along through the pandemic, and hadn't checked in a while, but it's from the New York Times, their coronavirus vaccine tracker. And they basically track every single vaccine that's in the various phases that it's in. So just to kind of look at this and say, there still continues to be more coming down the pike. The most likely next vaccine in our arsenal in the United States will probably be Novavax. They did apply for emergency use authorization or submitted data that was necessary. It's been a somewhat long time in coming. I think they had a lot of supply or manufacturing delays, but I think have partnered with the Serum Institute of India to really up production. So it'll be interesting to see. This is a nanoparticle vaccine, so a little bit different than J&J and a little bit different than the mRNA. This is just our continuing to track along our weekly doses, our doses per week, and predictably, the numbers dropped over the holidays. The graph isn't quite up to date, but on our website is always the doses administered in the last 7 days, and it's around 44,000. Now we were doing, as you can see here, over 80,000 a couple weeks ago. But in the national picture on vaccination, so again, from this new CDC report, we've been getting the percent of population fully vaccinated. We are number 15 in the country. So, and for our region, as you know, kind of a leader. And this is just kind of a reference slide, but this is also from the CDC kind of listing all the numbers. So we'll send out these slides. For booster updates, it does look like we'll have new booster recommendations. The ACIP is meeting Wednesday, so tomorrow, on the question of boosters for 12 to 15-year-olds. The FDA did approve it yesterday, Monday. So we are waiting, as you know, has been the pattern all along, for ACIP to sign off, and then Dr. Walensky and the CDC signs off, and then usually our medical advisory team fairly quickly, within hours, signs off, and then we'll, we should be good to go on Thursday morning with providing boosters for 12 to 15-year-olds, unless the schedule is somehow different than it has been. Also signed off, FDA approved a third dose for immunocompromised 5 to 11-year-olds. That is new and presumably will be signed off on in a similar time frame. And then Pfizer boosters, they shortened the window to 5 months. I think at least I still have some questions. This looks like it's probably, if you've had a primary Pfizer series and then you're getting a Pfizer booster, you can do that at 5 months, but whether there'll be more flexibility in that recommendation it has yet to be seen. So this is just our statewide progress for boosters. We're at 73% for 65 and over, which is, just keeps ticking up, which is good. Here's the graph. I'm going to kind of clip through these data slides. Vaccine administration for 5 to 11-year-olds, dropped off at Christmas time, hopefully picking back up again with both the news of Omicron and some of this booster news. Definitely across the country, PEAS hospitalizations are definitely on the rise. And actually the gray cap, I think, hopefully people have made the transition. I'm going to skip over these, which are, I think, our usual pleas for watching expiration dates and updating inventory. CDC definitely is drilling down on the inventory question, so we appreciate everyone updating. And then we'll circle back at the end if there are more questions about that transition to gray cap. And I will hand it over to Laura for updates on isolation and quarantine and antivirals.
Okay, great. Hey, can I go ahead and share my screen?
Oh, sure.
Okay, thanks.
Or I can advance them too.
Okay, awesome. Okay, so let me just go ahead and share. Well, it's just because I updated a few things on there. Thanks so much, Miranda, for doing all those. So I just wanted to update everybody on the 5-day isolation and quarantine recommended by the CDC. So what we did was, this guidance was issued last week on the 27th, I believe, right? It was kind of towards the end of the day. CDC updated the guidance. And so this required our team to then have to update all the call center guidelines and contact tracing. So what we're going to do is that we're going to issue the official guidance on Wednesday the 5th. And that kind of goes, that's tomorrow. And that kind of goes with the Omicron. The reason why the CDC updated this was to go along with the Omicron being more contagious and potentially less severe, and also like it causing everything to shut down. So the 5-day isolation and quarantine was developed due to that. And so we are actually right in phase with Omicron, like Miranda was sharing. We have about 79% of the S gene dropouts being shown that are most likely Omicron in the state, and our state epidemiologist, as well as our SLD lab people, believe that it's at least 50% of the cases right now are Omicron. So therefore, it aligns with the guidance from CDC. So this is the information that the CDC has on their website. So we have the link right here. So that'll be on the slides that you guys will get after this. But it's basically sharing with everybody that if you test positive for COVID, regardless of your vaccination status, and we're following this guidance, to stay home for 5 days. If you have no symptoms or symptoms are resolving after 5 days, you can actually leave your house and to continue to wear a mask around others for an additional 5 days. So that's the guidance we will be following. There might be some little tweaks in it. I think some of the concern was that if you, like, what does it mean to not have symptoms or resolving symptoms? So that might be some little tweak that might occur on our end. If you're exposed to someone with COVID, there's 2 different categories. So if you've been boosted or you've completed the primary series of Pfizer or Moderna vaccine within the last 6 months, or completed the primary series of J&J vaccine within the last 2 months, what they're doing is basically calling people up to date. So that's kind of the new thing that they're saying is that if everything here is up to date. And in that case, if you've been exposed, just wear a mask around others for 10 days and test on day 5 if possible. And then obviously if you develop symptoms, get a test and stay at home. The other piece is that if you're not up to date, that's the light blue part. So if you've completed the primary series of Pfizer or Moderna over 6 months ago and you're not boosted, or you've completed the primary series of J&J over 2 months ago and are not boosted or are unvaccinated, in that case, that whole category does stay at home for 5 days. After that, continue to wear a mask around others for 5 additional days. And if you can't quarantine, you really have to wear a mask for 10 days and test on day 5 if possible. And then once again, if you develop symptoms, get a test and stay home. One of the things that we've been doing is trying to change the language. People have said that isolation and quarantine is really confusing. And then we noticed that CDC also just writes stay at home, right? So like they put it in parentheses, quarantine or isolation, just so people know, but that's what the kind of language that we're trying to do to change on our website and also on our information material. And I think that's because I think this part of the COVID work that we're all doing together is really about getting the message out. And this is a complicated message. So we'll be sharing with you too. Chris, hopefully you can put up on the website once we get that done. Chris and team, thank you, Chris Schroeder and his team have been working on putting together a website that will have all the information for you regarding how to share with your patients and stuff about 5-day isolation and quarantine. Also, DOH will be having a special program. The governor has gotten us $1 million, money enough funding to buy 1 million tests. So that's in addition to the tests that Biden will be having. So Biden is starting a program that will start in about 2 weeks, they say in mid-January, where anybody in the whole state can get online and request a test. In addition to that, our Department of Health, in coordination with the governor's office, is going to have a home testing program that will be in high socially vulnerable zip codes, right? As well as locations with high case rates. So those will also be free and distributed through different community organizations, emergency managers, hopefully, and our different, programs like the WIC program, so that it can get to people who ordinarily have difficulty getting access to tests. So that's the program. And then it will come with a set of information that people can get on regarding like a positive test. And it just says, things like stay at home. It's the same thing that we just went through, but just showing you kind of some of the pictures and the stuff that will go with the home testing program, so that it's easy to read and people can hopefully know what to do. And then just also giving people information about how to prevent the spread of COVID when you stay at home because of COVID, and just kind of giving people options of what to do. So this kind of educational material will go out alongside the information that we share. So with the home testing, this test, actually the home testing, the initial pilot will be going out this week, right, Miranda? We'll be distributing to different nonprofits that we've been working with vaccine equity. And so they have the same links to the groups that have difficulty accessing vaccine. So hopefully they'll be getting easier access to the testing. So here's the update on the antivirals. So this, just so that everybody knows how to get to it, because there's so many antiviral and and also monoclonal antibody updates. So if you go to our webpage, this is information for providers. I don't know if you can put that on the link, Miranda, like on the chat for people, but you can go to this link right now, and then there's provider info. And maybe I'll just click on this link right now so people can see it. Can everyone see that? So you go to provider info here, and there's different information that you can get. So this is the COVID-19 monoclonal antibody treatment. So just for everyone's update, the only monoclonal antibody that has been shown to really be effective against Omicron is sotrovimab. And I think we just want to let everybody know too right now in this group that sotrovimab, we only got 17% of the whole monoclonal antibody set that we were hoping to get. So we have a huge shortage right now of an effective monoclonal antibody, and that's sotrovimab. What we are suggesting that clinicians can do right now is that prioritize your highest risk people for the sotrovimab, and that because we're kind of like this week, probably like 50-50 Omicron and Delta, by next week, it'll probably be 100% Omicron. So we won't be really able to use BAM-EDI or Regeneron, just so everybody knows that you should probably prioritize sotrovimab. And then, if you have other people and you run out of sotrovimab, you can give it a go for Regeneron and also BAM-EDI. So just so you know, so this is the information here. You can click onto that. So it'll have the information on the monoclonal antibody. The next one is that you can click on is the PrEP information for providers. So we do have the PrEP. And so you can get information here on PrEP and how to get access to it. And then the other one is the oral therapeutic. So I just wanted to show you how to get to everything, and then we'll go over the slides. So does anyone have any questions? I know that's a lot of information in a small amount of time. Okay, we can answer questions at the end. So the other thing that is going to be coming up is remdesivir also has been proven to be acceptable for Omicron, and also has a high rate of decreasing hospitalizations and death, but it's a 3-day thing. So I think the logistics is complicated too for getting patients, but if you guys do want to get ramped up for that, remdesivir, which isn't allocated right now through the federal government, sotrovimab, BAM-EDI, and Regeneron is. But remdesivir you guys can get on your own. You can also treat patients with that for 3 days. In terms of the antivirals, those are our other option for treating people with COVID. And we had to phase it just because we're getting so few doses initially. I can't remember how many doses of
It's
Paxlovid, but it's not a lot. Oh, it's
174 a week.
Yeah, it's not a lot. So the Paxlovid, which is like much more, is much more effective. I think it's like almost 90% effective if you give it within the first 3 days, and 80% effective if you give it within the first 5 days. That one is the one that we have the least amount. So this is the criteria for phase 1. Once we like have a lot more doses, we'll get rid of the phases. But for the Paxlovid, the treatment can be started within 5 days or less from symptom onset, and they must be COVID positive, must reside within an eligible county, and all that is in the, is there a link here? Yeah, there's a link here to the core COVID oral treatments. And then I'll go over the OMAS score, but it's an OMAS score of 6 or greater. It's really just a prioritization scoring. And then 12 to 17 years of age, and an OMAS score of 3 or greater. So these are all the criteria for Paxlovid. If you can't get Paxlovid and you can't get Sotrovimab or Remdesivir, then your other option is Molnupiravir. It's only 30% effective, but it's better than nothing, I guess, if we don't have anything else. How many doses of that are we getting, Miranda?
770 a week.
770 a week, so a little bit more. So this treatment also, same thing, start it within 5 days. You need a positive test, reside in an eligible county, and then the OMAS score of 3 or greater. And then this is the OMAS score. It was actually developed from the Mayo Clinic's monoclonal antibody scoring system, and was reviewed by, and obviously this is all guidance, you know, we're not saying you, like everyone is forced to do this, but basically this is the guidance for this very limited resource right now. And so for the OMAS score, here's the risk factors, and there's the points. So age 65 and over, BMI, you know, all these things right here that put you at high risk. We were concerned about immune compromised. So immune compromised got more points, as well as pregnancy. These were and chronic respiratory diseases. These are the ones that through the MAT team, the medical advisory team, suggested us score this way. So this is the information on the scoring system. Here's more information on the oral therapeutics. So here's all the information. The distribution is through Walgreens, and on the website, you can see like how to, you know, access all of these. And additionally on there, if you're not like within a Walgreens close by, community Walgreens will send the medication to the patient as well. So that's the distribution. This is the COVID prep information. So this is also the link to all the information you can get info to on the COVID prep. And this is more information. So it's like for people who are moderately to severely immunocompromised and not expected to mount an immune response. And a lot of people are like, well, how do I get access to that? And that's from that other website that I had showed you how to get to it. And this is a graphic that Miranda got from one of the websites that was really good. And it kind of goes through all the different treatments, the manufacturer, when it was issued, the mechanism of action, its treatment efficacy, and then the activity against the different variants. So I thought that was really good because it kind of like pulls everything together, and then you can see what all your possible, you know, types of treatment therapeutics are. So there a lot happened in the past week since we last met. And let's see, is this
This is also just another website, the New York Times treatment tracker. And so also looking at medications that might be coming down the pike, but also explains each one of them. So
oh, cool.
Another, just another resource.
That's awesome. Great. So I think that's it for today. I know there's a lot that we went through, and we just want to be open to any questions, but thanks for all you do. And I know that it's a lot with Omicron. I mean, we are worried about hospitals also being overwhelmed, even though it's not as virulent as Delta. Just the sheer numbers of people getting COVID right now makes us a little bit worried. So anyways, love to hear your thoughts and any, you know, suggestions for, you know, how we can work together more and improve everything. So thanks everyone for all you do. And yeah, we're open to any questions if anyone has any.
And it looks like there's a few in the chat. So the first question, which a good one, is it 5 months for all Pfizer boosters? So meaning from 12 and up. And at least from the EUA, it sounds like yes. You know, theoretically, there's the possibility that CDC makes a different recommendation, but that hasn't been happening. So that is how it's written. Then the question about fourth doses, there has been a lot about people like trying to get a fourth dose, but we haven't heard anything from CDC yet about fourth doses. Just, you know, again, I think most people know Israel has kind of been on the forefront of boosters in general. They have started giving fourth doses to, I think, 60 and over. So, you know, that then becomes kind of the data source for making decisions a lot of times for the CDC. So I guess we'll wait and see. And the one other thing I wanted to say about fourth dose, there is the immunocompromised group does have a recommendation for the fourth dose. So that's basically they get the third dose kind of in that primary expanded primary series. And then there is a recommendation for them to have a booster at, it was 6 months. I think if they've done all Pfizer now, it would be 5 months. So there is a small group of people that are recommended for a fourth dose. And
I just wanted to, oh, sorry, Miranda.
Oh yeah, no, go.
I wanted to add about the 5 months too, from our data, from our DOH data, shows that like after 5 months, you start seeing more breakthrough cases at around 5.5 months. So that data is really interesting that it kind of matched our data from DOH. So that's kind of cool for the 5 months. Anyways, I just wanted to add that.
Yeah. Okay, and then if I know I was thinking that would be cool data to share. We can.
Yeah, I'm gonna try to find. I'm gonna try to find. Oh yeah, that's what I'll do. I'll find it and then I can put it in next week's so that people can have it. Yeah.
So then a question about reporting home tests. And so the question is, if a patient reports or we perform a rapid antigen test in our office that is positive, how do we report to DOH these positive results? So for the patient reported one, so if you do a home test and go to your doctor and say, or your provider and say that you've had a home positive test, those don't get reported to the Department of Health in any way. So no obligation. And some people want to report it, but there really is no way to do that. I mean, people can definitely call the hotline if they have questions about kind of what their personal next steps should be. And we are kind of on that is often the question, like I did a home rapid test, should I go get a PCR test? And there's, you know, no recommendation to do that now in this setting of high cases. You know, unless there's some real reason to doubt the results, we should just be encouraging people, because testing is somewhat limited, and we have a good pretest probability that a positive is a positive. But, you know, people want to know, okay, what is the current recommendation? How long should I stay at home? Who should I call? They can definitely call the hotline, and their nurses on the hotline will walk them through that. If you as an office do, oh, go ahead.
Oh, sorry, I did want to note, this is a new thing that actually the EPI team just updated, is that NM Notify. If you go on the link here, you can report your own self-test. That's a new feature that they just are starting on Wednesday, they think. Is that if those of you who sign up for NM Notify, so it's part of the, let me just share it on the screen so people can see. And I also shared the link. Can people see this, the NM Notify? So on NM Notify, it's basically a system that's by your phone, and you get notified if someone's positive. And you can also, if you turn positive, you can either report it yourself, or you can get a verification code that says, I tested positive, and you can let the system know. And then they actually automatically contact anybody else inside the NM Notify system that they have been in exposure, and that, you know, tells them what to do. So I just wanted to share that, since that's a new feature that that the EPI team just updated.
And may not quite be updated yet, right? Like they were hoping today, but
Oh yeah, they're hoping
yeah.
today, but probably tomorrow. Yeah.
It's happening. But and that test doesn't go into the state database, but it will then notify your contacts. So yeah,
Correct.
good
Yeah,
point. So that might help with people feeling like they want to report their test. You know, especially again, if you were out at a big event and there's no way you can call those people. For tests that are done in the office, basically for reporting rapid results, we use a program called Simple Reports, and it actually is fairly simple to set up, and we can connect you with people in EPI to help you set up your own account. You know, all reports that are done in the office setting are required to be reported positive and negative. Some people are probably still faxing in results. You know, the EPI team would love for people to get on Simple Reports and do it electronically. So let us know if that's information that you want. All right.
And I'm just showing people how to get onto the takecarenewmexico.org website so that they can click here for updates and PowerPoint. So Chris's team here has a link, Take Care New Mexico for Providers. And then you click here on the yellow strip, and it should have the latest session here, and then the downloadable files. So, so I guess if we could just make sure we have the most updated ones here, then we can make sure everybody gets that. So I'll check in with Chris on that. So.
All right. Let's see. I think I skipped over a question here. Oh, when did you say the home testing program will start and the website? So there is a web page already, although not, you know, it's very, very basic. We have 35,000 test kits to distribute, hopefully getting them out this week. So again, that's going to feel, you know, it's just like a drop in the bucket, basically. And then hoping to, you know, are basically working on acquiring another 500,000 test kits. They come two to a box, and which is the iHealth brand. So, you know, it's 1 million tests, but you really can only hand it out physically to 500,000 people. But that will probably be, you know, I'd like to be optimistic and say next week. That's of course what we're hoping, but it probably will be the week after that that we'll have those. And then hopefully going into early February will be the either Biden administration's program up and running, and or the Rockefeller program that we're hoping to partner with the Rockefeller Foundation on a similar home testing program here in the state. But also, probably a little optimism in both those dates, I have to say.
Also, Tammy asked a question about the healthcare workers and if we were following the recommendation for CDC. So we are recommending people can use this as guidance. You know, not, it's like you may use this as guidance. We're not mandating it, but I put the link as well in the chat box. But this is the recommendation here for basically the CDC has given guidance on like work restrictions for healthcare providers with COVID infection and exposures due to Omicron. So like what happened in New York City was that, I guess, you know, I think many of you have heard of that as well, that so many healthcare providers got sick or healthcare workers got sick that they actually had to use either contingency situation, so they did the 5 days without negative tests, or some people actually did, some hospitals did crisis where people had been asymptomatic, but they were COVID positive and they still worked in the hospital or clinic. So we are recommending this as a recommendation and not, like I said, as mandate, but to go ahead and use the CDC guidance if you're having healthcare worker shortages. And then, sorry, I just was answering that question was from above. I don't know, there's more questions too.
Yeah, and it looked like, I mean, please do feel free to raise a hand or just unmute and ask a question. I think
absolutely.
Dr. Darwin chatted in. I can't see you on the, there you are.
Hi, I have a question here, Dr. Padron and Dr. Durham. This is Dr. Darwin here. Can I ask a question?
Of course.
This is in reference to the SARS-CoV-2 protease inhibitors, the oral antivirals. I'm speaking and looking at it from a pharmacy perspective, more on the medical pharmacy home, where our constituents or the recipient will be receiving the medication here. And I'm kind of bringing up an awareness here related to the Paxlovid, the combo antivirals that are being deployed to our users here, end users here. So as we know, there's a drug-drug interaction with this known awareness here. So I don't know if the clinicians, also pharmacists, need to be aware of the drug-drug interactions related to Paxlovid, related to other cytochrome P3A inducers and inhibitors, because these are widely published and they can cause significant harm to the recipient there. So I just want to add that advisory there, simply because, some of our New Mexicans do get medications from different entities there, just depending on the software tools that are there to track and mitigate these drug-drug interaction issues there. I just want to put that awareness with this group here. So I'm just sharing my thoughts here on what we're doing within my agency on how we're mitigating those issues as we're about to deploy Paxlovid in some of our locations. So those are just some of my comments here. Thank you.
No, thank you so much. And I just put the link in as well because it has all the information on the, yes, they definitely, every hospital clinic has to update on this. And we have in this link here, it has like you can click onto the Paxlovid and it'll go through the FDA, updates on what it is and all the interactions. And then it also, you can also get the COVID-19 oral therapeutics plan here. And then that will bring you to like downloading the actual plan that was put together by the medical advisory team. And it also goes through like the different criteria, ensuring the equity piece, the distribution, and then prescribing advice and all that stuff. So just wanted to let you guys know too that, sorry, we didn't go over all the specifics, and thank you for bringing that up, Dr. Darwin, that we kind of have that all inside that website. But we can also send it out.
And I think, I mean, just another good point in all of this is always like, nothing. I mean, Paxlovid just kind of on the surface looks like the silver bullet, but nothing is. And there are complications. I think with Paxlovid, even male birth control is recommended for 3 months after use. So no easy answers here, but thank you for putting that thought out there for everyone.
Someone also mentioned here that that a lot of primary care providers don't know that the orals are available. And I know we've been putting out these HANs or the health advisories, but is there a better way we can kind of share with people so more people know? Like, please share your ideas either on the chat or email us, just because what's the, what do you think is the best way to get information out? Because I feel like, when I was when I was at UNM, I didn't get Hans either. So I don't know what the best way is to get things out. So
even now the Hans go to the DOH junk, which I think is kind of funny, but
oh God, really? Okay, I didn't know that, but it doesn't go to
if you don't do anything active. So,
oh,
but
God.
yes, they would love to hear thoughts about getting information out. And I do, Tanya noted that we don't have, the slides haven't been updated, so we'll talk with Chris about, and again, don't want to junk up people's inboxes. We can, send a PDF version of the slides back out to the invite, although I think people get to this call from different invite lists. So, we can definitely do that.
Yeah, let's make sure that's updated. Yeah. There's another question. Any thoughts about false positive antigen results, even in times of high transmission? And I think, in the CDC, like information and recommendations and everything is like during high transmission, like perhaps, but like we're still treating everyone as a positive right now. If you get a rapid, I guess if you're really concerned, you can go and get yourself a PCR. But just because there's limited testing right now, and I think that's something we want to mention as well, there is like extremely limited testing right now because so many people are symptomatic or exposed. And on top of that, there are a lot of people who are unvaccinated getting their weekly, screening testing. So all those three things added together are really creating an issue. So we do want to like bring that up. So maybe just letting your patients know, I guess, if they're symptomatic, keep on checking, stay at home and then keep on checking for a test. Because even rapid antigen tests are in short supply as well. Like people are buying them up and it's difficult. So anyways, any other ideas from people? But we think like the most important thing is just letting people know, like if you have these symptoms, stay at home. And I don't know, Miranda, do you have anything else to say about the false positive, like any positive antigen test?
No, I think again, on any individual basis, it's worth having a conversation with people, but just as a general policy, we, like as Laura said, don't need to back up every single positive with a PCR. It's almost more important to save the PCRs for the negative rapid antigen if you have symptoms, because that's kind of a more high likely false negative. But of course, there will be kind of all kinds of situations, and then it's difficult when you get discordant results. So, I think there is a lot of room now, I think, with all the different recommendations for making some clinical decisions. But, I guess it's just kind of overall public health guidance. We've been in this phase just going with a positive is a positive. And that reminded me, vault, we have had some problems. So not only are like the supply chain, just because Omicron's everywhere, and so testing is up everywhere. So even our partners like, or our contractors like Vault, who have provided tests for the state, are feeling the squeeze because we're not the only state they're in. So we have heard that there's some problems, like sometimes if you go to order your Vault test, you're being told that you need to enter a credit card. And that is apparently a little bit of a glitch, but around the fact that they are capping the number of tests per day that New Mexico has access to. So the recommendation is just to have people kind of start first thing in the morning requesting their Vault test, and then that should go away. It still is a free program if you're ordering through the New Mexico link.
It's basically like a line, if you think about it, and they stop the line at a certain point in time and just say, okay, that's New Mexico's like set of free tests that we're giving out. And then after that, they put the credit card to try to, prevent more people. But it's not like New Mexico per se, it's just they're doing it everywhere. So I know there are a lot of rumors going around, like New Mexico's not paying for the tests and stuff. It's like, we are, it's just that they're cutting it off. And I think that's why we're trying to say, hey, if you do have patients, they're symptomatic, they can't get a test, just stay at home until they can get one, and yeah. And then someone else had a question. I would like to get set up with simple reports. Do you know who to contact for
So
that?
that's Jordan. And I can send out I think she has sort of a basic starter package that I can't put my fingers on right now, but I maybe just send that out to the group as well.
Okay, that's awesome. And then any updates on the QR code for COVID vaccine record?
Oh, yeah. So good news, and I don't know if Katie's on the call, but the QR code, which we've been talking about for months, but it is live on the patient side portal now. So if you use that VaxView NM and the COVID, there's sort of two, your general record and the COVID record, and you use the COVID record, you will get that QR code that you can then present that, basically just says, yes, you're up to date. Actually, I don't know the language they're using because that's kind of changed since we started. So we'll have to try it. And I don't know if anyone here has done that, but try it and come be more specific next week.
That's awesome. Thanks. And then it says someone would like a 1-pager info sheet for family member asking / reporting that their family member's anti-vaxxer. Can you clarify that? Is that a 1-page info sheet on like in general? Okay, so anyways, if you have any updates on that. And then it says, I've been hearing anecdotally of symptomatic folks who with initial negative rapid test and positive a day or two later. It's important to encourage folks to test on day 5 of symptoms and exposure.
So yeah, I think that is a good point. And again, if you are symptomatic and have a negative test, that is probably the most likely, false result from the rapid antigen. So the recommendation, and one of the reasons they do come to a box, is to repeat that test 24 to 48 hours later, or in that case, sometimes getting the PCR test is a good idea. And then definitely that recommendation does still stand, that if you're asymptomatic, you've been exposed, 5 days after exposure is kind of the target day for testing, even if you don't have symptoms. And good masks. I mean, really, I think with Omicron, the recommendation is really stepping up masks and making sure they're tight fitting. So, I love all my pretty cotton masks that various people have made, but it probably does need to be a surgical or KN95 if you have access to them, and then wear the pretty ones on top for extra layers. But we probably really do, especially in healthcare settings, need to step up the masks.
There's another question here too. It says, oh, I ordered a vault test on Saturday evening and it was delivered today. So eventually it gets to you. Also, any updates on not needing to enter all the questionnaire info in the DOH app for vaccination? That is something I think we have been trying to work on to see with Chris if there can be, more direct links so you don't have to answer all the questions as we did before.
Yep, that update is ready to go. We'll be reviewing that on Thursday with the providers.
Thank you, Chris. What instant service. Okay, that's awesome. Okay, thank you, Chris. Thanks for asking that question. And also just Chris, I don't know if you're on, but just update, if we could update all the PDFs and the YouTube links on the thing. I think the last one was in, they said October or something like that we could.
For Together NM?
What's that?
For the provider
Yeah,
screens?
yeah. For the,
Yeah,
yeah.
we'll get those updated today.
Okay, that's awesome. I know you've been doing 5,000 things, and shout out to Chris and his team here. They've been doing so many things to update everything, like the provider updates and everything. So
We'll get it going, yeah.
all right, thank you. All right, and it says my team loves you, Chris, so they are excited. There's the hearts to everybody. Thank you, Chris. Okay, and then
Thank you. Jody just sent the setup for simple reports. So
nice.
thank you for that. And so maybe if that's something you're interested in and you want to put your email in the chat, that might be the easiest way to get it to you directly.
Awesome, that's great. And then is there a difference between KN95 and N95 mask? Yes. Go ahead. Do you
So
want-
yeah, the N95 really should be formally fit tested. So is there an actual difference in the mask? I think there can be, and there doesn't have to be. What I understood is the K really stands for where they were manufactured. And KN95s we don't have the sort of quality control on them. So they can filter as much as an N95, but they don't necessarily. And there's not a recommendation to fit test them. So they're pretty good masks, especially if they fit snugly. And then the N95s in the United States are supposed to be formally fit tested. But also you can wear them and they filter out a lot of particles. But sort of more, what you buy in the stores is the KN95.
We also do have just a quick update on the app beyond just the medical questionnaire. We're going to be automating the Fill My Event requests for providers that have entered in vaccine events. So if you have an event in the system that is 3 days away and is 50% or less in terms of, well, I should say that if it doesn't have 50% of its capacity filled up, we will automatically trigger a Fill My Event request for the DOH to start promoting that specific event to get folks to you, as opposed to requiring the providers to do a Fill My Event. You'll be able to opt out of that if you don't want the system to automatically submit your events to be filled, and we'll be reviewing that functionality on Thursday. So just keep that in mind. I don't know if Rebecca Baldonado is on the call, but she's the one that sends out all of those notifications and is excited to try and fill your events as much as possible.
Great. Yeah, and I guess we can also share too that we now have 4 FEMA buses that will be having mobile team, will be helping to fill those mobile team events. So there are 4 different buses throughout every region. And then each of those buses will also have, well, hopefully National Guard teams that will go out and also help fill events that are smaller events and, you know, other types of situations where people are asking for events. So we are trying to, you know, keep up our mobile team events so that you guys can keep getting events from the community. I don't know if you want to add anything to that, Miranda.
Nope. I think we still do have the request a vax event form, so that is still working. The FEMA buses and teams are a little like, they do have to get scheduled in advance, so they're kind of mobile and in the communities, but not necessarily responding to, like, you know, if you need a mobile team in a week, that there's sort of less flexibility there than maybe our previous FEMA teams. But we still do have other resources for mobile events, and that's requested using the, why can't I think of the link, but the request an event form. And thank you, Alicia, for sending the Mythbusters
Yeah.
flyer.
Yes, thank you. Well, thanks, everyone. If there's, we hope we answered all the questions, but if there are any questions, please email us and we will add it to the next presentation next week. And thanks again for being here and all your support here to work together on this. So thank you.
Bye, team.
Bye. Thank you, everyone.
Thank you.